The Department of Justice formally rescheduled medical marijuana, classifying it as a less dangerous drug. And this evening, we take a look at the move and what it means for the industry going forward.
It's an honor to do this.
The Trump administration recently moved to reclassify state-licensed medical marijuana as a less dangerous drug. The change moves it from the highest schedule, Schedule 1, down to Schedule 3, which includes substances like ketamine, steroids, and Tylenol with codeine. Industry leaders like Meredith Buettner with the PA Cannabis Coalition say the order is an important first step in recognizing marijuana's medical use, as well as breaking the stigma around the drug.
Rescheduling is the most significant movement from the federal government related to cannabis regulation since they made cannabis illegal.
The change will allow for more studies into marijuana's clinical use, which Buettner hopes will lead to more federal support for research.
There's a lot of research really on the brink of breakthroughs that really could help us move the industry forward, move patient safety forward, move public health and safety forward.
The rescheduling comes as part of a years-long process started by the Biden administration to change cannabis regulations. It comes after a December directive from President Trump to the Justice Department to reclassify the drug. The president voiced his support for its medical use when signing the order.
The facts compel the federal government to recognize that marijuana can be legitimate in terms of medical applications when carefully administered. In some cases, this may include the use as a substitute for addictive and potentially lethal opioid painkillers.
The schedule change will also allow licensed medical cannabis operators to deduct business expenses on their federal taxes, but does not impact traditional access to banks for businesses in need of funding. Bills introduced in Washington and Harrisburg aim to create more financial options for new cannabis companies. However, Buettner says more federal action is likely needed before restrictions can fully be lifted.
We really need a complete descheduling of cannabis for cannabis to be treated just like every other business.
And the president has emphasized the order only applies to approved medical use cannabis, and there will be a set of hearings beginning in June that will consider a rescheduling of all marijuana products down to Schedule 3.